The IMpassion130 trial was set up to test the hypothesis that the immune checkpoint inhibitor atezolizumab could improve outcome for patients with metastatic triple-negative breast cancer who receive first-line chemotherapy with nab-paclitaxel. The IMpassion130 trial was a blinded, randomized phase 3 trial with 902 patients. Patients were randomized 1-to-1 to either treatment with nab-paclitaxel and placebo or nab-paclitaxel with atezolizumab. At ESMO 2018, we were able to present the final data for progression-free survival both in the ITT population and in the PD-L1 positive subgroup. We also presented preliminary data for overall survival for the ITT population and for the PD-L1 positive subgroup. In terms of progression-free survival, there was a significant benefit in the ITT population with a hazard ratio of 0.8. In the PD-L1 positive subgroup, the hazard ratio improved to a hazard ratio of 0.62, showing a statistically significant benefit for the addition of atezolizumab to standard chemotherapy. Looking at overall survival with only about 60% of the required events, there was no statistically significant difference between atezolizumab and placebo at this time point in the ITT population. However, looking at patients with PD-L1 positive tumors, there was a clear difference in overall survival, with 15.5 months overall survival for patients receiving placebo and nab-paclitaxel compared to 25 months for patients receiving atezolizumab, which is 9.5 months difference in overall survival. The results of IMpassion130 give clearly hope for patients in this difficult to treat subtype with metastatic triple-negative breast cancer, where up to now survival is still limited and is still only around 15 to 18 months. We have now shown that we clearly can improve overall survival, at least in patients with PD-L1 positive tumors, by adding an immune checkpoint inhibitor to chemotherapy. That personally gives me a lot of hope and will be the basis for further research in this area to improve for some of the other subgroups.